Okay. So today we have Miss Whitney Robinson of the Renee. And the Renee, mm, hold tight. This is taken directly from the website. We are a movement. We are aware of the data and the message around Black and Brown maternal health, yet we tap into our creativity to see change. Our jam sessions serve as an intimate yet impactful event for women of color to come together and redesign the current state of maternal health. Spaces are inviting and joyful, challenging and changing the narrative around our bodies and children, one idea at a time. Whether you're trying to conceive, baby is in your womb, and your arms are only able to be cherished in your memory, we believe your experience is valuable and your story necessary. So, with that being said, I don't want to spend a whole lot of time hashing out the statistics. We can get into that, but I do want to say that last Wednesday, CNN just released an article with the headline Black infants 3 times more likely to die under care of white
Mhm.
doctors. And that link is going to be in the description of this video, and it speaks to a number of issues in the medical community. Okay, medical racism, discrimination against Black mothers and Black babies, um, and it speaks to the actual numbers, right? Maternal morbidity for Black mothers mirror that same statistic for infants dying under the care of white doctors. Black women are 3 times more likely, or close to 3 times more likely than their white counterparts to die under the care um, of medical staff, period, in hospitals. So Whitney Robinson and her squad at the Renee state that they're committed to creating solutions to address Black and Brown women's maternal health outcomes. Yes, we know medical racism is a thing, and it has been for many generations now. Generations now. Okay, yes, we know that Black doctors and birth workers are more committed to ensuring that Black women and Black babies are safe in their care. All right. Well, the question that I have for Whitney, my first question, is home birth among the top solutions that you find in your jam sessions as far as redesigning the current state of maternal health? What other birth and care options are coming forward in the Renee's jam sessions?
That's a really good question. Um, I have to be, I'll share a little bit more about how it works. So we follow a design thinking frameworks. And so one of the things about design thinking that I think is important in this space is we actually think less about solutions
Mm,
and we think more about what the actual problem is. And so sometimes that may sound like the same thing, like, oh, isn't that one of the same? Well, the solutions actually can be dictated or influenced by the problem, right? So when we come together and we share stories, and from those stories, we identify what are called pain points or that areas out of your story that may have caused your experience to be less than ideal. And so some of those characteristics are those characteristics are the things that we identify as pain points. So out of our jam sessions, the solutions haven't been, oh, more access to care or access to home births or things. They've been more so, uh, for lack of a better term, access to more humanity. And so I think that it's in that, when I go through this, some people outside of the space often say to me, oh, I bet people want more of something to track themselves, or they want something um, that it may be like immediately we can create this. And I find that the problems are more human, very human focused. So you bring up midwives. Well, I mean, I've had all of my births have been attended by midwife. I've had 2 home births. Even my last, which was premature, was attended by a midwife in a hospital setting, I 100% believe that the midwives I've come across have brought more humanity to me in this space. But yeah, there hasn't been a specific solution to a problem that was, oh, more midwives. However, I do think the solutions of like, for instance, out of Durham, one of the pain point that came out of Durham, the major pain point that the entire group agreed on over a period of time, about an hour. These jam sessions are 2 hours. So within an hour and a half or so into it, the pain point that they came to was the lack of support.
Mm-hmm.
Lack of support was one of the reasons, or one of the things that caused them to have a negative outcome or a negative experience or less than ideal outcome. Now, not all of these people have had home births. I actually don't know that that anyone in that group had. These are random people with very different experiences. The one in Durham, there was a pediatric cardiologist, a doula, a writer, a vegan chef, a waitress, like a very diverse socioeconomically. So I lightly facilitate these so that they are as genuine as possible without feeling like I don't want to feel like I have to like influence what people are saying. But out of Durham, the major pain point was lack of support. And I think you and I know that, well, one of the benefits of, having a doula, having a team like that of birth workers is that support that you feel. But that I know that because I've had home births. These people may not have, but overarching lack of support was one of the things that they desire, or lack of support was one of the problems, and addressing the lack of support is one of the things that they needed to do in this session.
That's beautiful. Well, I know one of the things that always comes up for me is, and I try not to do this, but it's a habit that I have where I compare how things were for, say, our great grandmothers to how things are for us now, right? And how at that point in time, they knew that birth was not just sacred, but it was necessary for a woman to have that community and family support. So, um, culturally, for a lot of us who have relatives who were born in the South, for 40 days, they would put mama in the bed and keep her there. And they would take care of the house, take care, excuse me, take care of the younger children, make sure all the meals were cooked, and nurtured her and brought her back into the fullness of life so that she could take care of her children, once she was able to, once she recovered from the stress that, birth is physically, spiritually, and mentally on your body. So what you're doing is something that is really necessary because we do not have. I think what you'll probably find across the board everywhere is the overarching theme of a lack of support is what pushes women into, these kind of crises after birth. So my next question is a little bit personal. I wanted to know, was it your own birth experiences that influenced you starting the Renee, or how did it come about, essentially?
Yeah, I had a 22, 23 weeker that died, 2011. And so it was our first pregnancy, and I checked all of the boxes for what I think what would have made a successful pregnancy. It was our first, healthy. I was in my mid 20s. All of those kind of things. I was actually at that time, I knew I don't know why, but I knew I wanted out of hospital births. It wasn't like that was a thing for, I don't think the conversation was as like they are right now.
Yeah.
You know, back in 2011, at least not in my community. And no one in my family had ever had an out of hospital birth. The thought of an out of hospital birth, I don't think they would have been like, yeah, do that. It was like, huh? Like, wow, you can have a birth outside of a hospital is more what that conversation was like. But the birthing center that I went to at that time, I think it was because they listened to me. So I remember that day saying, you know, something feels off, and the midwife saying, well, let me just check you, you know, and her saying, you know, Whitney, you're dilating prematurely. Unfortunately, we have to escalate you to, you know, a local hospital under their obstetrics. And that's what happened there. But and ultimately, I did end up delivering prematurely, and that was that. But I will say, the pain of it was so defining in my life. It's kind of like before my life. It's like my life before then, and then that moment was almost like a cornerstone in my life now. And I still struggle with it to this day, you know, and but I do think that that experience, coupled with my background in tech, I've been in tech for about a little over 10 years. And the thing about technology, in my opinion, is that there's this emphasis on rapid innovation. And I'm just puzzled by the fact that in maternal health, I mean, these conversations around Black maternal health are like, you know, are centuries old. These aren't new. Like, why are we still having these conversations in 2020? But after my loss, I put out a survey out into the wild, before virtual was a thing. I mean, before viral was a thing. And I would say it went viral because I was just thinking, oh, a few little friends would apply or respond. But I think it like maybe 30 people or so responded. And I asked a few questions. If you've had a miscarriage, how are you coping on a scale from 0 to 10? With 0 being crash and burn, help me immediately. And then 10 being, I'm doing well, I've moved on, very little or no residual effect. And everyone minus one person was between 0 and 2. And that's when I knew I need to do something. Like I need to work on this. Fast forward, I ended up having 3 more kids. Boom, boom, boom. 3 in 4 years, and wonderful home birth experiences. Like just wonderful. And I decided, you know, I need to pick this back up. I had this moment, kind of this moment in my life. I was like, and just like really prayer. I was like, what am I doing in life? Like, what is next for me? And just had this my last child. Should I try to find a job? Like, what's happening? And you know, I always say it was like a dream. Like, it was like a dream state, like daydreaming, whatever you want to call it. And I heard the Renee, like just in that state, I heard the Renee, like, what am I going to call this? The Renee? And then what will it be? It was this kind of this impact on bringing midwifery back to the US. So I wrote it down. I promised to work on it. And I woke up the next morning to a text from a friend who lived in the Philippines, who I hadn't talked to in about a month. And she sent me a text and it said, hey, and I took a screenshot because it just floored me. She said, hey, Whitney, I have a friend named Renee who's pregnant and she really needs your help. And I just responded, oh my God, oh my God, oh my God, oh my God. And I knew, like, that's when I knew. So I picked it up, and I started losing sleep. And that was even further confirmation for me. I started losing sleep. I would lay down and all I could think about was Black maternal health. And so at the top of 2019, I said, you know what? if I were building software as a product manager, if I identify part of our software or experience where there's a subset, there's a group of people who have a negative experience, I would highlight them. I would go to them. I would talk to them. I would have them influence the change that we made in this software. Mm-hmm. Well, I was like, let me put my product management hat on. Well, how would I translate that to maternal health so that we can move quickly? And to me, it was for the folks experiencing the disparities, put them in a position to be the ones who do that change. Like, to me, it was real simple. Right. So that's how I got started. That's the reason why I do it this way. Mm-hmm. As opposed to just like, oh, I'm throwing out the solution here. I want I specifically focus on Black women who've experienced pregnancy, putting them into these design thinking sessions, understanding from them to get outside of my own biases, because I do have them, and let's do this thing. Let's not keep having this conversation.
Right. Wow. Yeah, I'm gonna be honest with you. When I went to the site, I was so curious because it's so beautifully presented. And when I read the descriptions, I'm like, okay, I kind of get it, but I'm not really 100% clear. But now that I hear exactly from you that there's a design framework, right? You have a background in tech, so of course, when you're dealing with tech, to fix an issue, you have to focus on the problem. So, right. So I really appreciate that approach. And I just want to say to your family and mine, because when I decided to have a home birth, my family went bananas. They went crazy. Oh, yeah. And I'm like, do y'all know that about 50, 60 years ago, we weren't even allowed to give birth in hospitals? Like, we had to give birth at home or in facilities with people who look like us. We could not go into these spaces. So because these spaces are not focusing on their problems, right? They're not focusing on adjusting those same old, like you said, those same old biases and isms and schisms, and the ways that they view Black women and Black babies, right? You know, you just not that long ago, you were 3/5 human. You were seen as cattle. You were livestock. So your birthing is gonna be presented like, oh, she could pretty much do it alone. Mm-hmm. Oh, she's complaining about a headache. She's complaining about high blood pressure. And money is not gonna save you from those outcomes either, because Serena Williams almost passed away on the birthing table. Remy Ma had a serious complication with her birth and with her daughter's birth. So it's like all these different issues that we face, there's nothing that's going to save us except us focusing on the problem. So while we know that medical racism and doctor prejudice play a role in Black maternal health outcomes, how can we come together to address and adjust the disparately high rates of preeclampsia, high blood pressure, diabetes, and obesity before, during, and postpartum for Black women?
Yeah. So when I hear that, when I hear about like morbidity, you know, my first thing would always be to address it with the people who have that or have gone through, you know, a pregnancy experience with some type of extreme case of disease. Like, I would go to that community. You experienced preeclampsia during pregnancy. Okay, you experienced preeclampsia during pregnancy. Like, I would throw these people in a focus group. Okay. Yeah, it won't. I'm sorry. You have to find something else. So I would go to that group. Like, I would specifically highlight it before I would even think about what to do for them, or how to solve their problem. I would, or even just specifically like a solution, I would first think, let me talk to this group of people.
Yeah.
Because if you go in that way with just kind of this thinking of, I'm not the expert, they are,
Right.
you know, then it opens you up to just the creativity that I mentioned on the website. So for folks, again, who've experienced preeclampsia, get a group of people together who experience preeclampsia, identify as, Black or brown, and get them to share, provide this safe space, this inviting space for them to share, and listen out to the common, again, pain points or the common things that led up to, maybe their diagnoses, or led up to whatever ended up happening, an induction or whatever. And that would be the first thing I would do. I wouldn't even think about beyond that.
Got you.
And it will most likely open up really Pandora's box on the options that you have to addressing whatever the pain points were that these people experience. But I do think morbidity is another, I think it is another challenge in this space as you look at morbidity and its effects on outcomes. And how do you, like, it is a good challenge, because it's how do you influence or affect like those things, and at what stages can you do that? Before, is it a before pregnancy thing? During, after, when do you start doing that work? But again, I think once you have those people in a room, it will become clear.
Right. Okay. See, we need this. So how can people, maybe not necessarily duplicate your model, because your model is yours, but how can someone, let's say in Illinois or Arkansas, facilitate this kind of open conversation?
I say the work we do is very open source. Like, I in no way want to own this movement. I think we all need to work together, sharing resources, sharing ideas. This is not, I would like to, for especially Black folks in this space, to push against this very, like, good old boys, this is mine, I own it. Right. No one else is in. I need to have all the cookies. And just to figure it out for yourself, pull yourself up by your own bootstraps. I think we need to avoid that, because I think it hurts our community, and it hurts the people, again, who go through maternal health in this country. Our ideas need to be shared. Right. And they need to be, that's, again, a part of that rapid innovation, right? Like, if you can do what I'm doing better, you keep doing that. I'm just gonna be over here, and please take it, run with it. The end goal, like, let's not miss the forest for the trees type thing. So if people want to do this, my first recommendation would be to read up on design thinking. There are some very good, like, articles out there and on how to just do this. The reason why I think ours is effective is because we're intimately connected with the community. Right. So it's different if maybe I was a white provider inviting a group of Black women into a room to talk about Black maternal health, and for me to understand, it has a whole different feel. Right. But when you see me, you come in the room and you see me, it's like, okay, sis, let's talk about this. And then, like, there are things that you may not be saying, but I know what you're saying. You know what I'm saying? You may not specifically mention, I don't know, whatever, but I'm deducing, and I get it, because I also went through something similar. Like, okay, what, I'm hearing this from you, and we can continue to talk about that. So that is the privilege that we have, that we are so intimately connected to the community, that other folks outside of our communities who have honestly been in this position to take care of us can't get with it. Like they just, it's that is why I believe that the experiences of our people have been dismal. It's
Right.
because we've been in the care of people who are outside of our community,
Okay.
and or in systems created for people who aren't us. So yeah.
Mm-hmm.
So that's how, like, basically I said a lot. Read up on design thinking, but also the other thing is, if you're not in healthcare, I am not in healthcare. I like healthcare is new to me.
Mm-hmm.
But think about what skills you have. Are you an artist? Are
Mm-hmm.
you a policymaker? Are you a politician? Are you a chef? You know,
Mm-hmm.
think about your skill set and mesh the two. How do you solve problems as a chef? And maybe you're tackling food deserts.
Mm-hmm.
Bump that over here to maternal mortality, maternal morbidity, and do
Girl,
that.
you better say that word.
But there's a lot of things that we
Mm-hmm.
can do without trying to be in healthcare traditionally, right?
Mm-hmm. I know. Wow. Before I decided to go, well, I've decided all the way back when I had my daughter in 2014 to go hard for birth work because I was appalled at the outcomes in this state. We live in North Carolina. You live in North Carolina too?
Mm-hmm,
Yeah,
mm-hmm.
I was disgusted. Like, this is I believe at the time that I was giving birth, it was one of the top 10 worst states to have a baby in. Might have been the top 10 best, but the numbers were still so like so fucked up. I was like, I don't want to have my baby in a hospital. And it is illegal for a midwife to attend a home birth, right? So, I don't know any rogue midwives. I know I aspire to be one, but I don't know any. So how can I do this? So I watched a whole lot of birth videos. I studied a whole lot of birth instructional videos and read a lot of books. And I decided to have an unassisted home birth. And I am in no way encouraging anybody to do that because it was a big risk that I took, not having someone who was trained for years at a time to assist me with that, right? So I got lucky twice.
Mm-hmm.
Um, Now, I know that your model is to, or what I gather from our conversation is that your model is to gather as much information as possible and not necessarily to lay decisions out, but to lay options out. From the studies that you've run, right, and the jam sessions that you've had, if you had to say, not advise, right, not advise, but if you had to speak on what some of the top three, maybe not solutions, but alternatives are to hospital
Mm-hmm.
birth in every state or in this state even, what would you say? Or what three things do you need to ensure your safety when you're giving birth in a hospital? Let's put it like that.
Mm-hmm.
Most of us are not going to do unassisted home birth, right?
Right. Yeah. Okay. So this is a good question. While I love my home births,
Mm-hmm.
I would love for all of us to do it.
Mm-hmm.
I think we should be very clear that there's a very tiny percentage of Black folks who are having home births or out of hospital births.
Right.
Very, very small percentage. We need to be focusing on, if our goal is to reduce mortality,
Mm-hmm.
then we need to focus on where people are having births more, which is the hospital.
Right.
So I know, like, even I cringe sometimes thinking like, oh, I still have to focus on the experiences of people in a hospital setting. But that is where the majority of our people are still birthing. So
Right.
while I think there is still the need to have this education around your options, like home birth, birthing center, etc., there also needs to be, and what the GM sessions and all of the data, the qualitative data that I've gathered is showing, is that it is very important for us to get, talking about that lack of support, that is very important for us to build systems around or create resources and such for Black folks, period, that help them feel supported going into whatever type of birthing space they're going into.
Right.
That is very important. It cannot be have a home birth, y'all. Like that's what you like. You just, it's not you're gonna miss so many people. We're not there. Like
Right.
Honestly, we're just not there.
I agree.
We're so far removed from, like you were saying, when we had to do that. That at this point, I would even venture to say, when I told my grandmother that I was having a home birth, she said, Whitney, that's what we did because we were poor. You know, why would you do that? There's like culturally, there's a lot, right? That has to be addressed there. There are levels to this while we are doing this in the hospital. It is kind of this, like, that if you think of it as the opposite of what poor people do, there's this generations of people who may think the hospital is the best, the cleanest, the safest. It's what wealthy, there's that kind of, you know, keeping up with the Joneses type thing. You know, that's why you go to a hospital. That's where the expertise is. So fighting against a hospital thing is futile. People having births in the hospital, how do we support them so that they live through a hospital setting?
Absolutely.
And that's going to be hard. That is really hard to do, but that's what we're up against. It is possible though. So at this point, the Renee, and at this point, the Renee has done this work of identifying these pain points. We've gone throughout the country. We're based in Durham though, and we now, you know, I think it's time for us to now build something. It's time for us to like say, we're going to tackle this one major pain point, like lack of support. And we're going to build something, likely digital, that we put out in the wild so that we can constantly learn and map people's experiences to it. Like, how did, you know, we're tackling lack of support. We put this out there. Is it helping people? And then just constantly iterating, learning and growing. And that is what I want to do. Constant. And that to the point where we can say, you know, confidently, by us addressing lack of support in this way, people are having better outcomes and better experiences that lead to better outcomes. We are focusing on experiences and not like, you know, I'm not out. And if I am, I should be very careful. I'm not out here to say like we are improving maternal mortality and that's it. I am out here saying, I believe that we can improve experiences.
Yes.
And those experiences will likely improve outcomes.
Right.
But we don't know yet, right? Like we haven't had any kind of real test around this. We don't know. We can't just say we're going to improve mortality and throw a whole lot of things out there that you can't test.
Right. And I think, the thought just came to me, would it be possible to run jam sessions with OBGYNs, midwives, doulas in a group together to say, listen, listen, this is what your clients are saying about you, right?
Yep. Yes, I have done that also. I've had one with, I actually did one with clinicians or healthcare providers, and then mixed the group up with Black women and did it again. And so, but you know, thinking empathetically for clinicians,
right?
And this group, or you know, healthcare providers. This group was not. The healthcare providers were not all Black. it is interesting to know, I think, that they were also seeking more ways to appear or be humane with, you know, their clients or their patients. I think you're absolutely right. That there needs to be this work with them too, to understand where's that breakdown happening, even in their care.
Right. Ashe. Well, Mama, do you have a final word on Black women giving birth to babies out here?
Yeah, you know, COVID is definitely causing this. At least I'm seeing a lot of and reading a lot about fear. You know, I don't want to have a baby at all, and why would I have a baby now, and all these kind of things. And I definitely think it is valid. I also just had a baby in COVID, so let me tell you. But I want to encourage people to find community. If you're around people who aren't engaging conversations with you about birth, or who just are really negative about it, find somebody else. Like, there's always like, even people will still be negative with me, and I've had 4 kids at this point.
Right.
You know, there's still that, oh, I bet you won't do that again, and I bet you, like it. Okay, find a tribe of people, not who will just tell you what you want to hear, but who will listen, will engage in conversation with you, who will edify you, who will uplift you, whatever that decision is. And the other thing I like to say and just remind people is that we were built for this.
Right.
And that narrative out in the wild in the media that, oh, woe is the Black woman again in birth. Put that. Don't hold that. Remind yourself that I come from generations of people who've done this, obviously, because that's why you're here.
Thank you.
You've come from generations of people who've done this. So find the beauty in that story, and then just keep moving forward.
I do want to tell you too that I had a very emotional moment when you were talking about your child that you lost in 2011, and I want to offer my condolences and tell you that even though it won't be something that you'll ever get over, it is something that you can use to assist other women in this process, which you have done, and you honor the time that they were with you by doing that. So thank you for the work that you do. I would like to dedicate this episode to our ancestors: Gladys Milton, Dorothy Farabee, Mary Frances Hill Coley, Rachel Datcher, Margaret Charles Smith, and I would like to thank my modern midwives, Shafia Monroe, Rachel Tahani Lawler Queen, and Jenny Joseph, who just started the first direct entry midwife program owned by a Black woman in the United States of America. So, yeah, giving birth on your, last few things. Giving birth on your back is anti-gravity. I don't know why hospitals still allow this. I wish that they would allow women to stand up or squat or at least be on their knees when they give birth, because it helps the baby descend a lot more comfortably for the mother. Leave that baby attached to the umbilical cord for more than a minute. I don't know why hospitals decided to clamp at a minute. The cord is still pulsing and pulling blood from the placenta into the baby. So leave that baby on that cord for more than a minute. And you have the right to refuse and delay as many vaccines as you like. So to all my mothers who are being pressured in these hospitals and coerced and pushed into doing things that make you uncomfortable, this is your birth experience. You get to lay the law on how you want this to be for you. Okay? So thank you so much, Whitney Robinson, for coming through. And I can't wait to see what great things the Renee does in 2021 after all this COVID mess is over.
Agreed. Thank you so
Right.
much. I'm glad that I could be here.
Yes, thank you. You have a good rest of the week.
Thank you. You too.
All right, bye.
Bye.